Measuring elbow extension, patient can be in a seated or supine position. Just like flexion, have the axis of your goniometer on the lateral epicondyle, the stationary arm running along the shaft of the humerus, and the movement arm running along the shaft of the radius. Rachel, if you could, bring your arm up into flexion for me, and now bring it all the way down into extension. So this is what 0 degrees of extension looks like, because what we're fighting for is that 0 degrees. Some people have hyperextension, and if they do, their arm will come out, about right here, and that will be, plus 10, plus 20 degrees. Now, Rachel, what I want you to do is I want you to pretend that you cannot bring your arm into full extension. So line it up. Here, let me bring that back a little bit. There we go. Okay, so right here, what we're looking at is this is approximately, so she should be down here, right? But all this space, she's lacking. So what we want to do is we want to find how many degrees she's lacking right here. So she is lacking, so we're looking at this number right here. She's lacking approximately 80 degrees of extension. So we would call that negative 80 degrees of extension.